My name is Satya. I'm a mechanical engineer through and through, but I'm working in a health department, and that's because machines are boring. But I'm taking a step back. I've learned a little bit about biology and how humans move, how my parents face difficulties using their hands, and I'm trying to build something to help them out. I'm far from actually being in a position where they are helped, but they feel nice that I'm trying. Parents are like that. All right. So we are thinking about hands, and hands are incredibly understudied. Um, However, they are the primary way in which we interact with our environment. It is the primary way in which we modulate and modify our environment. Um, it is the most sophisticated motor control ability that we possess, and that's despite an incredibly complex musculoskeletal structure. That picture there is supposed to just invoke some awe at how incredible our hands are. There are a bunch of muscles. The primary muscles that kind of allow you to grasp things do not reside in your hand, they reside in your forearm. They cross the wrist and then they innervate your fingers. So if you want to grasp something, these muscles are going to try and bend your wrist. But you don't. So there are muscles on the other side of your hand that kind of avoid that from happening. So this is a coordinated dance of a lot of muscles that allow you to do the things that you do. Um, um, so manual dexterity naturally is one of the last competencies that you develop as you are growing up as a child. Unfortunately, it is the first competency that you lose as you age. So first in, last out. Um, and the reasons are, there are a lot of reasons here. That's one of the problems. We have muscle atrophy, we have neurophysiological changes, there are cognitive declines, and all of these are coming together so that your manual function is decreasing. The typical way that decline in manual function is measured is just measurement of strength. So to the right there, you have a dynamometer. What all you do is hold it and squeeze it as hard as you can, and it will tell you how hard you can squeeze. The second one is a test of fine motor dexterity. What you have to do is pick up these little no, what are they called? Pegs, thank you. I am aging. You have to pick up these little pegs and put them in these little holes. And there are 9 pegs and 9 holes, and all you do is measure how quickly you can do it. There are established norms, so given your age, you should be taking this much time to finish this task, and depending on how long you take, it's an indicator of how well you're doing. But that's about it. It tells you how well you're doing, but not why you're doing as well or as bad as you're doing. Um, and all of and manual decline really matters, right? Imagine yourself trying to have to figure out new ways of accomplishing the things that you have to do all the time. This dovetails really well with Dr. Pitts's talk. If you are working in an industrial setting as you're getting older, you are taxing your cognitive resources more to accomplish the tasks that you're doing, primarily using your hands. And you're taxing cognitive resources that are depleting with age as you grow older as well. So there is difficulty in multitasking as well. This would lead to social awkwardness, and in serious cases, it leads to social isolation. And imagine all of this with a pathology on top of it. Arthritis is pretty common, so manual function with arthritis suffers even more. And the most striking case for this is provided by this one review. This is a review of quadriplegics, and the question asked was, if there is one function that you want to recover out of your therapy, what would it be? And an overwhelming majority say manual function. Yeah, it's like, it's just stunning. So this little finding is not surprising when you have all that background. Loss in grip strength and dexterity predicts the chances for assisted living as you grow older. And even then, we feel that manual function problems are severely underreported. I don't really know why, and I would like to hear from the audience if you have any insight on this. My best guess is that it is a little embarrassing to talk to one's physician about what one cannot do if one cannot use one's hands. Furthermore, this is also undertreated. If you go to a typical rehabilitation clinic, you have a lot of instrumentation to help people walk, stand up, maybe use their arms to reach to things. But I very rarely see things that allow you to grasp your cup of coffee after you've reached it. Forget about drinking from it. So, and the final nail in this coffin is it seems like clinics are reducing their frequency of testing for dexterity impairments. So the guess there is, okay, I will test how well you're doing with your fingers, but if I see that you're not doing so well, I have no idea what to tell you what to do in response. All right, so this is my little diagram to explain what's really going on. You have manual problems that are underreported and undertreated. You have a complex system that we do not really understand very well. So if you tell me that manual function is suffering, it is really hard for me to figure out why exactly. And because of these things, you are taxing your cognitive resources that are depleting as you age as well. So all of these factors have a serious negative impact on manual function. And as manual function declines, there is a higher chance for ending up in a assisted living facility. So my lab is trying to measure manual function in a slightly different way. We measure manual synergies. Now, synergies are a measure of how your fingers are cooperating to accomplish certain tasks. This is different from strength. This is a measure of coordination. What people have found is with age, synergies weaken. They are more sensitive measures than strength is. For example, in pre-Parkinsonian populations, we found differences in synergies, but not differences in strength. And these individuals have not been diagnosed with Parkinson's using any traditional measures. These were welders and farmers who were exposed to certain kind of chemicals, and they are known to be at a higher risk for Parkinsonians. All right, so this is a typical synergy experiment scenario in my lab. A person is sitting with this little device, and they have a computer screen, and they press with their 4 fingers on force sensors. And the sum of the 4 finger forces is provided as feedback. So your 4 fingers are collaborating to generate a single force. And they play little video games. Could we have the first video? So in the first one, all you have to do is put the X, which represents your force, in the square box, and the box doesn't move. In the second video, which is the dexterous task, the box moves around, and you have to chase it. It's like chasing the rabbit, right? And at one point in that task, it stops moving, and then it starts moving again. So if we make people do this many, many times, and it takes about 7 or 8 minutes tops, and you get the kind of data you see at the bottom left and the bottom right. At the bottom left, you see you increase your force and just stay there. And you expect nothing is going to change, so I'm going to sit here. So all your fingers are collaborating with each other. If one finger makes a mistake in their force, the others take care of that error. Right? That's collaboration. That's synergy. In the second one on your right, you are jumping around and you are staying stationary for a while, but you expect to start jumping around again. So right now your fingers are collaborating to stabilize your force, but very soon they are going to have to change their nature of collaboration. And what we find is in older adults during that steady state, your current error starts increasing. So what I see here is just by anticipating movement in the future, what you're doing now becomes less accurate. So this, and by the way, they are producing really, really small levels of force. So what we are seeing here is not tiring. It has nothing to do with strength. It has everything to do with cognitive inputs, anticipation, and how your body responds to anticipation of future action. So anyway, so this is a really clumsy lab setup. We require people to come to our lab. So the idea is to build a portable setup, right? So I want to take this out to the community, measure synergies and their modulations in response to what's happening, establish reliability and age-specific norms. What should be your synergy level given your age? And the goal really is to have this measurement in your local pharmacy. So you go pick up your drugs, measure your blood pressure, and then measure your synergy. And if you have, and this is work by my undergraduate student, lovely, intelligent person. That's the stage of development we are in. The prototype is kind of ready. We are assembling it. It's really small, so it's the size of your hand. And if I can make it cheap enough, I can use it, take it to doctors' offices and rehabilitation clinics and gather a lot of data. So all the data I'm talking about comes from a bunch of experiments performed in laboratories. The sample size here is 200, 400, 500 people at best. I want 50,000. So that's what I'm aiming for. All right, so possible benefits. First of all, I think it's really safe. All you're doing is sitting in a chair and pressing on a bunch of sensors. There is no risk of falling. There is no vertigo, anything like that. It is probably going to be an effective monitoring device. You can go to your healthcare provider and give them a specific number or a change in your behavior, rather than saying, I'm starting to drop objects more frequently. And hopefully, this will lead to more meaningful conversations with your healthcare provider. And hopefully, in the future, I can devise interventions or some sort of video games that allow you to recover your function in a meaningful fashion. All right. Thank you very much. If you have any questions, please feel free.
This question. Did you control on how I don't want to quite use computer active the older people who you were studying were? Because I think that I'm wondering whether actually this is age or whether this may also be how much they're accustomed to this. Like as a Mac person, I spent all my life, having to do that. But if I didn't, I think that probably my dexterity would be, my Mac takes me more dexterous. So did you control on that so that it's an age effect and not just a frequency of doing those sorts of manipulations?
Yes, we did not. We made the assumption that our task is it's kind of easy to do, and we provide a bunch of practice before we actually measure. And they do not really need to interact with any computer. All our participants have to do is press and watch a screen. But we should control for it.
They seem like similar processes. That's
Yes.
In
Yes.
terms of
Yes.
cognitive
Yes.
training to automatically do this.
I agree. That's a good thought. We will try and fix that one.
My name is Richard Nelson, and I turn 89 tomorrow. And I'd like to make a little mini speech rather than ask a question, but it comes out of the last presentation and this one. I've learned that I ought to have long underwear on when I exercise. I do large muscle exercise, but I need to warm myself. And I also need, instead of always doing a large muscle movement, I need to do the small muscle exercise. That's what I've learned. And I'm going to do things. I have trouble doing the small buttons on my shirt. I give my shirt to my wife to button the small buttons on my shirt. I'm going to stop doing that. I'm going to force myself to do my small buttons, and I'm going to do lots of other small exercise. So I thank you both presenters for cueing me in, and then I'll stopping doing the small motion exercises. So, thank you.
Yep. No. Thank you very much for that. It means a lot. It gives me the motivation to keep going down this path.
And I'd like to be on your study.
Oh, that's great success. This talk is a success.
So I have a question if you have collaborated with physical therapists who are working with younger children who have fine motor disabilities, because I know there's a lot of focus in physical therapy with younger children to work on handwriting skills, to work with those fine motor finger dexterity movements. And I was curious if you were looking into that, because maybe it can provide insights.
No, I haven't, but if you know anyone who's willing to collaborate, I am all ears. There has been, this is a really good question. This technique that we use it's a recent development, maybe 15, 20 years since the measurement technique, the mathematics behind it was developed. But over 20 years, there has been one paper with young people and their finger dexterity measurements. So people are clearly thinking about it, and not enough has been done. And I would love to do it.
Okay, thank you very much.
Thank you.
Satya.